Welcome, everyone. I'm Donald Weeks, the founder and CEO of ClearPath AI and the host of the Clinic Efficiency Podcast. I'm really excited for today's conversation. Today, we're joined by Shelley Saxena, the visionary founder and CEO of Sevamob, a company that's truly making waves in delivering accessible healthcare. Shelley, it's clear from your work that you deeply are committed to leveraging technology for social good, and your experience spans across a diverse industries, bringing a unique perspective to healthcare innovation. Welcome, Shelley.
Donald, thanks for having me on your podcast.
Yeah, and Shelley, can you tell us a little bit about your background and how Sivam came about?
Sure. I was born in India. I did my bachelor's from IIT Roorkee, and then I did MBA from Cornell. And before MBA, I was doing product development at IBM. And after MBA, I did product management channels and go-to-market work again at IBM. And then an episode with my mom where she was incorrectly diagnosed and almost lost her life because of hepatitis C is what led me to this venture, Sevamob. And the learning was that if that could happen in a tier 2 city in India, the situation in tier 3 and rural was even worse. So we started as a B2C service where we provided primary health care to rural families on a subscription of $2 per family. And very quickly we realized that that model would not scale and take a lot of capital. And so we switched to a B2B model where we started providing general primary health care on a subscription model to customers like employers, schools, and so on. And so that clicked. And then the next learning was that if we could split our service into and focus more on a specialized rotations. So, for example, vision and nutrition and cardiometabolic and infectious disease, then we could increase our average revenue per user. So all these tweaks helped us become achieve unit economics, and we became sustainable as a result. And then our customers demanded, initially it was a service delivered by our mobile clinics, and then our customers demanded that they wanted access to medical advice and consultations when our mobile clinics were not there on site. And so we added telehealth to provide an end-to-end hybrid solution. And then a couple of years ago, we started dabbling with AI because there were specific requirements in our workflow. So, for example, roughly 40% of low-income patients in India or countries like India are malnourished. In rural, low-income communities, the dietitians are hard to come by, and when they are available in those areas, then they're pretty expensive, and the quality of care from one to another is is different. And so we developed that diet AI to enable a nurse to provide that level of consultation without needing a dietitian. Same way, tuberculosis was a big focus of government of India, and there was no good screening technology available. So we developed our Sputum AI. So one thing led to another, and that's how today we are an AI-assisted disease management platform through which the cost of primary care can be reduced by as much as 50%.
Oh, that's fantastic. Well, Shelley, your LinkedIn profile highlights your extensive experience in technology and your passion for social impact. What initially drew you to focus on healthcare, particularly in the areas like dialysis care, and how did that vision for SivaMob begin to take shape?
Just want to correct you there, Donald. We are not in dialysis care. We provide primary health care, focusing on five type of interventions. Those include general health, vision, nutrition, cardiometabolic, and infectious disease. And in each type of intervention, we provide physician consultation on site, either via an on site physician or an online physician. We provide point of care testing for a range of conditions. So these include things like HIV, syphilis, hepatitis C, malaria, dengue, typhoid, cholesterol, urine, sugar, hemoglobin, and so on and so forth, with reports in minutes. These are generally pinpricks and dipsticks. And then, if the intervention so it requires, we can do more advanced blood testing by using whole blood draws. So that's the point of care testing piece of it. And then we bundle generic medicines for everyday seasonal conditions. And we also which we provide to the patients as part of the service, and we write prescriptions for stuff which is not covered as part of the service. And we also, for example, in vision intervention, we dispense prescription glasses and so on and so forth, depending upon what the objectives of the intervention are.
Okay. Yeah, that sounds good. I know, like you just said, your mission is to provide affordable, accessible healthcare. How are you thinking about scaling this mission, especially when it becomes to reaching underserved populations and what roles does the operational efficiency play in achieving that?
Sure. So first of all, from day one, our while we do serve tier one and tier two, from day one, our focus has been on tier three and rural. And especially if you look at our current patient like in the population, 80% of our patients are low income and 20% roughly are middle income patients. 52% are women, 70% are women and children. So because we had this focus from the beginning, first of all we developed our model in a way that it could provide service to or care to a large population while not needing a lot of capex. So what that meant was doing it via mobile clinics or mobile vans. That way, a single medical team can serve patients in a total say a rate of say 5 kilometer 2 hour radius from the base. And so fewer medical personnel can serve a larger set of patient population. Now that was one. The second was on the technology side. So on the technology side, our focus was to develop a platform which could operate offline or near offline in a low resource setting. And that's how we developed it from scratch. So a lot of our capabilities in the platform can work in that fashion, except for things like video and so on, for which you do need the connection. The third thing was, and that's one of the reasons for getting into AI, to first of all increase the protocols that we could do at last mile from this medical team, especially from nurses and frontline health workers, and also reduce the cost of delivering the interventions by using AI. So that was the third way we improved the efficiency and streamlined our operations. So for example, we currently have 8 AI-based medical devices. So Symptoms AI enables a nurse to do a physician level triage directly using our software. Same way, Diet AI, as I mentioned earlier, enables her to predict multivitamin and mineral deficiencies and recommend a diet plan. Lab Report AI enables her to analyzes the tests which were done and provides a summary and suggests next steps. Medical Evaluation AI assigns score 0 to 100, makes recommendations. And same way, we have FDA Class 2 type devices, for example, for Sputum AI to screen for tuberculosis, Blood AI to screen for iron deficiency anemia, Vision AI to screen for diabetic retinopathy, and X-ray AI to screen for tuberculosis in chest X-ray images. So I would say these three enabled us to provide care on the last mile in low resource settings to low income populations in a very streamlined and low cost, low capex fashion.
Yeah, that's really amazing. I mean, taking the technology and leveraging it and moving it out to the areas where people really need it and can get access to it is that's really truly amazing. Um,
Thank you.
very nice. Yeah. Can you share an example of a specific technology innovation that has been most effective in streamlining your operations or enhancing the patient care?
Sure. So I started with the diet AI example earlier. So malnutrition is an intervention where we use two of our AI based devices. And the model is a nurse first uses our symptoms AI to perform triage. And then, based upon that, if it indicates the likelihood of, say, malnutrition, she does BMI and hemoglobin testing on site. And based upon that, the patients are enrolled in the program and they are provided counseling using our diet AI, and they are provided supplements and other behavioral change information as part of the service. And if they need, then we also provide teleconsultation with a physician if needed. And we do this for the whole year with at least 3 to 4 visits per patient. And based upon that, we have been able to prove that we have improved BMI or hemoglobin in 13% of the adults in a study in India. And currently, we are doing a similar intervention in Bangladesh, where again the results have been very encouraging so far in the first year of service.
Yeah. Well, Shelley, what are some of the challenges you've encountered in implementing some of these new technologies and processes within your operations?
So some of the challenges we discussed earlier. So if you're operating in a low resource setting, you have to think about your platform and its ability to operate in those settings from day one. You cannot assume always on connectivity and so on. And so you have to design the different features and capabilities accordingly. So that's one challenge from the technology perspective. The second challenge, obviously, is this is medical data and digital health, right? So you have to take into account all the patient privacy issues, make sure that data is not accessible to non like key stakeholders and so on and so forth, right? And it's not misused in any way. So there is a challenge that would be challenge number two, which we have appropriately addressed in our platform. The third is staying current with these technologies. As you know, in AI, there are new advancements, new tools, new things every week almost, and so you have to figure out how to leverage the right AI, I would say APIs or components or technology in your work or in our workflow, and how to deliver impact on the last mile. There's a lot of cool things we can do, but that does not mean we have to do every single one of them. We have to prioritize and line up those resources for those technologies which make most sense.
Right. Yeah. Well, looking forward, what types of metrics or signals are you using to drive clarity and ensure that SivaMob is moving in the right direction, both in terms of patient outcomes and business growth?
So some of our key performance indicators include, for example, number of patient consultations per year, reduction in cost of primary care for a specific type of interventions. To date, we have done around 4.2 million patient consultations, and currently we are doing around 72,000 plus patient consults per month. On the reduction in cost of primary care side, we have been able to reduce the cost by up to 50% depending upon different interventions and objectives of the intervention. Then, early detection of infectious disease like tuberculosis is another one of our KPIs. A reduction in vision issues by up to 25% using our interventions. That's another KPI which we have achieved with different groups. A reduction in malnutrition in select groups. Again, we have been able to do that by up to 15% in different groups. So those are some of the KPIs which we track, and those help determine what technology we adopt, what models, and what solutions we provide to the patients.
Yeah, well, that's very good. That sounds good. Well, beyond the technology, what leadership principles or team building strategies have been most crucial in fostering a culture and innovation and client obsession with SivaMob?
I would say, first of all, I would like to share one data with you, data point. Our management team has been working together for almost 10 years now, and there has been very little attrition in the management team. So that shows we are doing something in which the management team truly believes and which they like to deliver on consistently year after year. I would say one of the leadership challenges is to build a team around you which not only complements you, but which believes in the mission of the organization and is in it for that mission and not just for monetary benefits or some other incidental benefits, right? That's number one. Number two is that the founder slash CEO should be ready to pivot. And so pivoting is really important. As I mentioned in the origin story, like for Sevamob, we initially were B2C, then we switched to B2B, and then we made certain other changes in the model all along the way in order to be a bit positive. And I would say the initial idea written on a napkin is not the final idea which somebody executes on most of the time. So you have to be willing and able to pivot quickly.
Absolutely. Yeah, you have to be flexible and be able to pivot. What strategic bets is SivaMob making right now that you believe will be the biggest impact on the future of accessible healthcare?
There are two main areas. The first one is to expand our AI portfolio, increase the number of medical devices, and add support for more diseases in existing medical devices. So that's number one. Number two is to replicate in other geographies by using a portfolio of AI, our AI devices, point of care tests, telehealth, panel of specialists, optional generic branded generic medicines if needed. So with that package, we want to replicate our model in additional countries, additional areas, and that's a key focus for us.
Well, that sounds really good. Well, Shelley, that sounds exactly what our audience was looking for with a company like SivaMob. The new technology that you're advancing in, that you're using, but you're using it in a way that is truly innovative, to get out to the people where they live, where they need the health care. And you're providing that detection and also devices, as you said, that is really going to improve their healthcare. I really appreciate your insights, Shelley, and I think this was incredibly valuable. I really appreciate your time for doing this. Anything else you'd like to add for the audience here at the end, or what you would like to say to a clinic that's looking to maybe expand or add some AI technology into their business to help them? What kind of insights can you add?
I would say two things. First, from Sevamob perspective, we are looking for partners, typically existing clinics in other countries, which might be interested in providing our model or similar model with the portfolio of services that I mentioned, products and services. So we would love to partner with you. Please do reach out. And that's number one. And number two, I would say don't be afraid to dabble with AI. Don't be afraid to incorporate AI in your workflow. You would realize very quickly it's not intended to replace the medical professionals. It's intended to make them more productive and increase the protocols they can do, increase their efficiency, and so on.
Yeah. Well, thank you very much. I think that's very helpful.